Hey guys, so I had chapter 16, part 2, which are the anti-arthritis agents. These medications are used to block the inflammatory process in the patient's joints that cause pain and deformities. First off, a little background. Rheumatoid arthritis is a chronic systematic disease. It is an autoimmune disease, so the patient's body is attacking itself. Patients have high levels of rheumatoid factor, or RF, which is an antibody to IgG. The RF interacts with circulating IgG to form immune complexes. These get deposited in the synovial fluid of joints. These immune complexes activate an inflammatory reaction and the release of tumor necrosis factor, or TNF. This causes the release of lysosomal enzymes that destroy the tissues surrounding the joint, which causes further inflammation. This starts a continuous loop of tissue destruction and inflammation. This results in severely damaged joints filled with scar tissue. Some signs and symptoms are heat, swelling, tenderness, morning stiffness, and joint deformities. The medication classifications that treat this are the gold compounds, the TNF blockers, the glucocorticoids, and other anti-arthritis drugs. I'm a visual learner, so I decided to do my video a little different, so please excuse my bad drawings. Okay, so our first class of drugs is going to be the gold compounds. There's only one medication in this group, which is the Aranafin, seen here by the gold nugget with the AU in the middle symbolizing gold. The macrophages eat the gold salts, seen here by our little macrophages. This stops the lysosomal enzymes from being produced. So our Aranafin saves the tissues, shown by the tissue box here. This medication should not be used while a woman is pregnant or breastfeeding, seen here by the baby. And a nursing intervention, we should recommend the use of contraceptives, seen here by the condom. We need to monitor for gold toxicity, shown by our toxic waste. We also need to monitor for acute renal failure. And we need to make sure that we're monitoring our platelet count, shown by the counting plates. Platelet count should be done every month, as well as a urinalysis to monitor for blood or protein in the urine. The most common side effect of this medication is diarrhea, so we need to educate the patient on that. We should also be educating the patient to watch out for any blood in the stool, shown here by the eyes watching the blood drop. Next, we have our TNF blockers, shown here by our beaver who builds dams, blocking the water. They work by lowering the TNF levels, shown by the evil TNF man in the down-moving elevator. They slow the destruction of joints by slowing the inflammation response, shown by our slow snail. They are given sub-Q, shown by our syringe, educate patients on injections, rotating injection sites, and how to properly dispose of needles. They increase your chance of cancer and infection, shown by our cancer can. Common side effects are drowsiness and headache, shown by the bed and the crying man, so make sure to educate patients. Routine monitoring of labs such as white blood cells and platelets, monitoring for infection, shown by our calendar. Make sure to not give live vaccines to patients, shown by our vaccine jar. And most importantly, before administering to patients, screen patient for TB, hepatitis, sepsis, infection, and cancer. TNF blockers slow the inflammatory process, so these can be deadly for patients. Okay, next up we have glucocorticoids, shown here by our bottle of glue. They are indicated for short-term treatment of inflammation disorders. They impair the ability of the macrophages to leave the bloodstream, preventing them from entering the injured tissues, shown by our macrophages in chains. They block the production of antibodies such as IgG, preventing the immune complexes that deposit in joints, shown by the locked up ants. They can be administered topically, orally, by nasal spray or injection, shown by our tropical island, our pill, spray can, and syringe. Beware use for diabetic patients due to the glucose elevating effects, shown by the high number on our glucose monitor. We should be assessing for infection and history of steroid allergies before administering, shown by our high fever and our giant A. They should only be used in pregnancy when absolutely necessary, shown by our blocked off pregnant woman. They also increase your chance of cancer and infection, shown by our cancer can. And most importantly, when stopping this medication, we need to make sure we taper down the dose shown by our tape. So the takeaway parts are: test for infection before giving to a patient because these medications stop inflammation. Monitor glucose levels when giving glucocorticoids to patients. Monitor signs of inflammation and pain to determine effectiveness. Patient may have local irritation at injection sites, so monitor patient. Outweigh the risks because most of these should not be given to pregnant women. And lastly, most of these medications are used when conventional methods have failed, so advocate for your patients that they start on conventional therapies first. Thank you for watching.